Welcome out there in television land to yet another edition of It's Your Health. Philip Benyo with Philip Benyo, bringing you the latest and greatest in healthcare information. We'll be right back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. Remember, we're your leader in healthcare information. We'll be right back after this brief commercial message. Welcome back to the first edition of It's Your Health. Philip Benyo with the Fipster here, all knowledgeable and all-knowing, and we'll be providing you with the latest and greatest. Hey, Happy New Year. Isn't it unbelievable? It's been a fairly mild winter this year, but I'm telling you, despite the weather, the bugs are all around there. We're seeing a lot of GI illnesses, nausea, vomiting, diarrhea. And some of these viruses just don't go away, Phil. Have you noticed that at all? People expect a cure within 3 days of amoxicillin, and it just didn't happen.
It's unfortunately, that's after the virus, there's an inflammatory episode, and it's that inflammation that really dogs people, and they want the quick cure. And you know, last year we had a similar type inflammation. I have people say, you know, people ask me, when do you think that cough's going to go away? And I said, I don't know, 30, 40 days. Yeah. You know, it's a 3-4 week slog, and you know, everybody loves to read side effects when it's a pill they don't want to take, but when they want to take the pill, they don't read those side effects. And so if you read the side effects of an antibiotic, one of the most common side effects is cough. Antibiotics actually can increase airway inflammation. I learned that from a pulmonologist that used to work at our hospital. And you know, we would have that happen all the time. People would come in for their illness, you know, they get slammed on an antibiotic and they start coughing or cough more and then wonder why. So antibiotics aren't always the answer. Sometimes a tincture of thyme and some things to reduce that inflammation.
We suggest Boilo. That's the drug of choice. Speaking of headlines, Phil, let's dig into this segment's headlines.
Barbecued and smoked meat increases the risk of death in women who have breast cancer.
You know, that's disheartening because who doesn't like wings or bacon, or I think we're built for meat, and we're built for meat that's
this is not going to be a good episode
fried and burnt. So tell us a little bit more about this.
Well, what they didn't look at to see whether or not it causes cancer, although there's some studies that may show that. But what it showed is if you're someone who has breast cancer and you're consuming fair amount of portions of barbecued or smoked meats, you have a better chance of dying from that cancer. I think we all know that, you know, increased red meat use, things that are smoked, people always would say, oh, if you burn your toast, you can get cancer from that. Burning things and smoking things does change the DNA and increases a lot of free radicals, and a lot of dangerous things get made in when we do that. And so when we're consuming those things and we're integrating that into our body, you know, sometimes it's no surprise bad things can happen.
And you know, it's very interesting you say that because Tom Brady, of course, of Super Bowl fame, he has a very interesting diet out there that's very low in acid and very high in the alkalines. And of course, there's no meat or smoked products involved in all that stuff. Right. So maybe there's something to it.
All righty, this goes in the headlines of the, no crap. All right, 4 monkeys had their calories restricted and they broke aging records.
You know, they used to do that in mice, by the way, and the longest living mice were ones that were relatively starved. And caloric deprivation, without question, at least in lower mammals, will extend your life. Whether it works for us, I don't know. And again, life is to enjoy. I'm kind of an eat, drink, and be merry sort of guy, but you're not saying that, right?
Well, I think you have to pick your poison. You know, it's interesting. They actually have studies that show quite the opposite. And the difference is they started that starvation, quote starvation, calorie restriction. If they start it when in their adolescent or younger years, that actually is very deleterious or causes a lot of early termination of life. So it's important that people have a normal, healthy diet as they're being nurtured and grown. But once we become adults, we really should restrict our calories. You know, we live in the amount of calories we as Americans consume compared to other countries is nothing short of astronomical. You know, compared to some countries, it's more than double or triple.
You know, and as an anecdote, you may agree with this. When we do our nursing home work, the 85-year-olds, 90-plus-year-olds, they're all skinny little old ladies or men. They're not very heavy.
No, they don't carry that heavier weight.
Right.
Alrighty. The time of year we were talking about cough, I think it's important we review. There's a couple of new medications that come out, new recommendations. But let's talk briefly about COPD. What does it stand for? What does it mean?
Right. Chronic obstructive lung disease is one of the leading healthcare problems that we face. In the olden days, we talked mainly about smokers, who was someone who eventually suffered from COPD. But I think the air is dirtier. We're getting into more air pollution kind of problems. And so we're seeing this disease more and more often. And the way I sometimes view it is what's reversible and what's not reversible.
Right. When you think of COPD, we think about the elasticity of the lung. And so if we think of rubber band, we have to stretch that actively. That's how our lungs work. We use muscles to pull air in. And then the natural springiness of our lungs pushes the air out. And what happens when people have COPD, they lose that elasticity. So they no longer can push air out. And so their lungs classically get bigger and bigger and bigger. And you look at somebody who's in their 80s who's had COPD all their life, they have this big barrel chest on them. They have all these lungs, but they can't use them. They can't move the air. So really, diagnosing COPD is relatively easy. That can be done with a pulmonary function test, and sometimes just by listening, we can hear some evidence that someone may have COPD. But that can be confirmed with a simple pulmonary function test, which is blowing in and out of a tube that a computer measures your lung volumes. Once we diagnose that, it's really important that we start treatment right away, because COPD, once we start losing that elasticity, that is going to have a certain course that it's going to follow. And if you do nothing, the disease will get worse. A certain avoidance of the activities, stopping smoking is probably paramount, or other environmental exposures. But then we want to get on some medication that helps slow down that progression, because if we do nothing, it will continue to progress to a point where we have a harder time breathing, we can't go up and down the stairs, now we need oxygen, and we really become crippled by it.
Right. Now, the old school was bronchodilators and maybe some steroids, but there's new information on the market that says we should be using more what are called anticholinergics.
That's true. The old school and still current school is we still use the long-acting beta agonist. That kind of dilates the lungs, opens them up, and then the steroids to reduce the inflammation, and those help the symptoms. People feel better when they take those, which is why they feel great. But at the end of the day, they don't really do too much to delay the progression of the disease. The only thing that does that is the anticholinergic. So the old recommendations would be get a steroid on board and then a long-acting beta agonist. And that's what a lot of these different medications here do. The newer recommendations are saying we really should get the anticholinergic on board first, and maybe the steroid's not such a great idea. It's kind of like almost a reversal. We do this in medicine every 10 or 15 years. We completely reverse course and go a different way, and I think we're in that trend right now.
It's like eating meat on Friday, and as predicted, this is the fastest half hour in television history. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. I'm with the Fipster here. A font of knowledge is the way we would describe today's show, right there, Phil?
That's the goal, is to educate the masses.
We're going to move on with some more headlines.
More headlines. This is kind of a neat, because it's always an old wives' tale. I always heard it growing up, but now they had to study it. Chocolate consumption may worsen acne symptoms.
You know, I grew up with that, and this is part of the Eat, Drink, and Be Merry segment of our show. But tell us a little bit more about that.
Well, they studied it, and it is true. They actually put kids on chocolate and then put them on jelly beans. And the ones that were consuming chocolate, their acne got worse. The ones that consumed the jelly beans, not worse. And so I'm not sure what else. Maybe it's the fat content. Maybe it's the caffeine intake. It could be a combination of the two.
Yeah, that's too bad, because chocolate has other tremendous healthcare benefits, but I guess not as a teenager.
Alrighty, and this again, the theme of today's show, the second headline's like a, no crap. Alrighty, healthy lifestyle can offset high genetic CAD risk.
Yeah, we've always said you had to pick good parents in order to live long, but some out there in television land are saddled with genetic issues. Mom and dad may have had heart conditions, and I've found that very hard to escape, but you're saying you can.
Well, I think there's a reason for that. That's a lot more psychological too. But absolutely, if you decide to break rank and really clean up the life, clean up your diet, exercise regularly, and really follow clean living. And then let's say you have risk factors, we address those risk factors. You have high blood pressure, let's treat it. You have high cholesterol, let's treat it. You know, let's aggressively manage those risk factors, and we can start to divide off from our parents' path. I think too often, you know, as kids, we look at our parents and say, well, that's just how it's going to be for me. And so they'll also make the same choices food-wise and diet-wise that have gone with that lifestyle. And unfortunately, lifestyle, although it's not genetic, it can be inherited.
Right, there's no doubt. And you know, mom and dad may not have had the advantage of statins, which you're going to learn a little bit later today, is truly a life-changing advantage that we now have that perhaps parents or grandparents didn't have.
Yeah, absolutely. We're able to manage these risks a lot earlier and address them, whereas before, your LDL was 160, I guess watch your diet. There wasn't really a lot we could do, but now we can.
Right.
So let's talk about something different. We haven't talked about this in a few years, but I think it's important. You know, we have patients that come in all the time. They start having, you know, temporal pain. They might be having some visual disturbance, and they're having headaches, and it's usually always on one side. And you know, they take aspirin, it doesn't help. They take Tylenol, and they come in, and you take a feel, and you can actually feel like a little cord underneath there. What do you think?
Well, you're talking about giant cell arteritis, which is an inflammation of that artery, and it should be easily diagnosed with what's called a sedimentation rate and a clinical history and examination. Very important, because if you go untreated with this inflamed artery, that can lead to blindness on that side of the eye, which is irreversible. So getting the proper diagnosis and treatment, which of course is steroids, high dose right away, and then ultimately getting a biopsy of that artery, and they can put you on a different path. Now, the other thing that I think is important is giant cell arteritis is actually a spectrum of what we call vasculitis. Vasculitis is an inflamed artery. And there's a cousin of giant cell arteritis that we see perhaps a little bit more frequently called PMR. PMR stands for polymyalgia rheumatica. And this is a vasculitis, but it involves the muscles, not the joints. And these people ache. They have painful muscles. And again, they typically will have a high sedimentation rate. And there's a thing called a kiss me test. I don't know if you've experienced this, Phil, but what happens is if we suspect this diagnosis, we do a sedimentation rate, we give them very low dose prednisone, and they call up the next day and say, I want to kiss you, because they can paint the house and are virtually cured overnight of this illness. So polymyalgia rheumatica, giant cell arteritis, kind of a spectrum of vasculitis as it goes beyond just aches and pains.
Yeah, they definitely do coexist, and usually those for that PMR patient, we usually, what I like to think of it as girdle pain. It's not going to be like a diffuse all over muscle pain. It's usually in the shoulder girdle, or it's going to be in the hip girdle, or it can be in both. And it's easy as a clinician to sit and hear, oh, you know, okay, it sounds like your shoulder's acting up. Let's go for an x-ray. Well, that'll be completely normal. Let's try an anti-inflammatory. That won't work. Let's try some Tylenol. You could even use the higher dose narcotics, and they will not touch that pain. Right. It's not until you get a sed rate and you're like, oh, this is easy, and you give them a little shot of steroid, and it will just, within 12 hours, that pain is gone. Now, long term, the problem with PMR, people who have PMR have a higher incidence of getting temporal arteritis and other vasculitises. The problem is we don't have a better treatment than prednisone. Right. Sometimes people are on prednisone for a long time, which does have its associated side effects. Usually we can taper it down to such a minimal low dose. For the temporal arteritis, sometimes it requires high dose.
Getting back to the biopsy, Phil, so we think you have giant cell arteritis. We get a sed rate. How much time do we have to get a biopsy?
Well, we used to think that you had to get the biopsy and then start the steroid, because if we started the steroid, we make the inflammation go down and we can't prove you have it. And sometimes I've had people that I really thought they had temporal arteritis. We started to treat it, and by the time we got the biopsy, it was negative. Well, it turns out that's okay to do that you really have to start the steroid right away. That is so important, because that's going to what ultimately preserves your vision, and because you can lose an eye this way. So getting on that steroid right away, and we have up to 4 weeks to get that biopsy done, and it will remain positive, at least on the biopsy side.
All right, so one-sided headache or muscle or girdle pain, as you say.
Alrighty, let's quickly talk about two new drugs because we don't have a lot of time in this segment. Let's talk about Entresto. This is something new. Actually, it's a combination of two old to make a new. It's a combination of Diovan and Secbutrol, which is a medication we use for heart failure. For people with class 2 and beyond heart failure, we use this medication. It helps just keep the fluid status down. It acts as a mild diuretic, and it will help just prevent recurrent hospitalizations, which we see in heart failure a lot.
No doubt. And what we're doing is increasing the efficiency of the pump of the heart so that it's not, when it's pumping, seeing high pressures. It actually lowers the pressure and makes the heart beat more effectively, keeps you out of the hospital.
Last one, this is called Celequa. This is really exciting. This is actually a combo of a GLP and a long-acting insulin. And this is a shot that we would take, and you take this once a day, and it actually has a long-acting insulin in it that's a 24-hour insulin combined with a GLP, which is similar to like Byetta or Victoza, but this is another company's version of it. GLPs are one of the few things that, in my opinion, actually help reverse diabetes. They increase beta cell function and will help just help your body manage your sugars on your own better. It has a cool weight loss side effect. It's rare we have cool side effects. They're usually third arms and bad things. But this actually has a good side effect. You can actually drop a little bit of weight on it. So very exciting to have this in a combo because I have a lot of people that I have on these individually, and so that's 2 shots where now we can combine it into one fancy shot.
You know, it's unbelievable. We were talking with one of the drug reps, and when I was trained, we had insulin twice a day, and that was it. And now the armamentarium is there's a whole counter full of stuff to treat diabetes, which unfortunately is an epidemic. Well, we've gone through the second segment of It's Your Health, and we're going to be right back after this brief commercial message. Remember, we're your leader in health care information. We'll be right back. Welcome back to the final and third edition of It's Your Health. Philip Benyo with Philip Benyo, bringing you the latest and the greatest. Shall we continue?
Once again, the assault on red meat continues.
Oh no!
Men who regularly eat red meat have higher risks of developing diverticulitis.
Oh, that's not good news. That's not good news.
That hurts.
Yeah. But tell us a little bit more about this. How is this and why is this?
Well, I think it just goes back to, you know, men who are consuming large amounts of red meat are probably not consuming a lot of green leafy vegetables and things that actually help prevent diverticulitis. I'm not sure that there's necessarily an inflammatory role. However, the red meats certainly do play a role in inflammation, but a lot of it's not only what you're consuming, but what you're not consuming. You know, there's been some recent recommendations from, you know, the heart associations that if you're consuming red meat more than like once a week, that increases your risk of stroke and heart attack. I mean, there's a lot of good arguments to let the cows alone.
Right. Well, you know, I've always felt that we're hunters and gatherers, but there is a caveman mentality to us as well, so you have to fight that.
Well, I don't think, if we really go back eons ago, we weren't hunting and gathering cows. You know, I think that's something we've domesticated rather easily, and I think, you know, there's a lot of arguments as to that's one of the reasons it's how we've domesticated a lot of these animals.
Exactly, no doubt.
Alrighty, and again, second headline, what's the theme?
Bad news.
The USPSTF recommends that statins are to be used to prevent chronic or CVD.
Good
CAD.
headline. A good headline. Well, I'm a big statin proponent, if you will. I know as soon as we talk about that, patients go on the internet and find out about all the bad things that statins have been reported to do. And I think that perhaps in some selected individuals that may be the case, but I think the benefits far, far outweigh the risks. Statins, particularly some of them, are anti-inflammatory. They can reduce C-reactive protein, which is the main culprit in plaque formation, coronary artery disease. And we've had many patients who we've seen with, for example, carotid stenosis. We check their carotid Dopplers, they have plaque buildup, they're not a surgical candidate. We put them on a statin, we drive their LDL below 100, repeat the carotid Doppler study, and the plaque is gone. I mean, to me, that's the fountain of youth. You're reversing disease. come on, what's the issue here?
Yeah, I think it's real easy. There's enough data now that if these pills are really killing people, they wouldn't be the #1 prescribed drug in the world. They're one of the most popular drugs on the planet right now, and it's for good reason. And a lot of what they do is one of those things we've kind of found by accident. At first, we discovered a drug that lowers cholesterol, so we used it, and it turns out it lowered cholesterol, and we thought, well, and as a result, people were having less strokes and heart attacks. So cholesterol is what the key is. And so then we came out with other cholesterol medications. We came out with Welchol, we came out with Zetia, we came out with medications that are not statins but lower cholesterol. But you know what those pills didn't do? They did not lower stroke and heart attack risk. So is it cholesterol or is it something else that we can't measure? It's certainly part of it, but the statins are doing something else special. Now we have these new injections. Repathy is one of them. It's a cholesterol shot. It's like $20,000 a year for this stuff. It does a wonderful job at lowering your cholesterol. However, the data as to whether or not it helps lower stroke and heart attack risk is somewhat suspect. I'm not sure where that's going to be at. There's some data that suggests it does, but we got to look at the individuals they chose.
You know, keep in mind that hardening of the arteries, you may not want to believe this, it's a pediatric disease. More than a share of 18-year-olds who are unfortunately killed in war and autopsies are performed, they already have plaque buildup. They already have hardening of the arteries. So it starts as we enter this society, and it continues to build and build and build. And this is the only thing that is going to reverse it, I think, safely and effectively. But again, you got to check with your doctor, and there is a risk-benefit to anything in life, but I think in this particular case, the benefits certainly outweigh the risks.
Yeah, certainly the recommendations from years ago when statins first came out was just to lower cholesterol, and we really didn't use them for primary or secondary prevention. It was really just to treat a number. And so now what the USPSTF is talking about and other agencies are saying, we really need to take a look at these meds and use them for primary prevention in different roles, and not necessarily look at people for a cholesterol number, but look at their risk factors. And so if you have bad family history, if you're a smoker and you have high blood pressure, that's enough. Yep. You don't need anything else. I don't even care what your cholesterol is. You should be on a statin.
Right. Yeah.
So that's an easy argument. Now, March, big month. What do we do in March?
We think spring, wait for the geese, and check our colons. Is that right?
That's right. March is Colon Cancer Awareness Month. So what's the main, how do we prevent that? Or how do we not so much prevent it, how do we look for it?
Well, you have to look for it. And, you know, who wants a colonoscopy? The prep is tough. It takes a day out of your time. Usually we would start screening at the age of 50, earlier if things run in your family like polyps or colon cancer. I'm not necessarily a fan of checking your stools for blood, and I'm not necessarily a fan of this thing where you send in your stool samples and they check the DNA, because it will not pick up a polyp, in my opinion. It will not pick up a precancerous lesion, and there's nothing better than direct visualization. Is it risky? Of course. You can perforate a colon. You can have anesthesia issues and whatever, but considering that colon cancer is what, the #1 or 2 cancer in our area, we've had a couple of patients who we said, you know, you need your colonoscopy, they never got it, and bad things happened, and it's unfortunate when you're in the prevention business.
Right, that's really what it's all about. You know, getting back to the older screening methods and some of the newer ones, you know, the problem with the occult blood testing is you know, it's the premise that all cancer is bleeding, and that's not true. It may not be bleeding that day, and so why is it going to be that one lucky day or 2 days that I screen for that a year that's going to show up? It kind of gives us a false hope that we're correct. The newer testing with the Cologuard, which you're referring to, I think in the younger populations who are really who are low risk to have a problem with the colonoscopy, I think that test doesn't make sense. I think for much older individuals, that colonoscopy has a higher risk, but we really need to take a look. That's not a bad idea. But of all the people that may have been candidates, so far we've had one person do it. And I still have those same questions. I'm like, well, what does their colon really look like? Because I don't know. You know, do they have something else going on there? Right. You cannot beat visualization. But for that particular person, we couldn't get him off the blood thinners. It would have been too risky to deal with that. He was a little bit older. That's what we had to do.
Yep. So,
That's it. That's the fastest half hour in television.
Do you want to review briefly some of these COPD medications we talked about earlier?
Sure. We have the combo therapies, which are really common now. That's your Advairs, your Symbicorts, your Duleras. These things contain a long-acting beta agonist or a long-acting albuterol combined with a steroid. We have some of the newer agents. This is called Spiriva. This is the anticholinergic that we're talking about, one of the only style of medications that actually can help slow the worsening course of COPD. And then we have things like Stiolto that actually hedges the bet. This is Spiriva combined with a long-acting beta agonist. That's a once a day. Most of the long-actings you have to take twice a day. Right. Whereas this version you get to take once a day. And that's kind of the same thing with this version. This is kind of a Me Too drug. Does the same thing, but it's also once a day. There's so many different potions and powders right now. Sometimes you have to find the right one for you and for your insurance.
Exactly. Well, thank you for allowing us to come into your home and inform and hopefully entertain you. Thank you for watching It's Your Health on Samsung Productions, which is your leader in healthcare information. Thanks again.